Hi, I'm Sophie, a PEBC OSCE expert from dosette.ca. In this video, I'll walk you through a sample OSCE station and show you how to structure your response to demonstrate all key competencies: communication, clinical outcomes, and overall performance. Let's get started.
Hi, I'm Dr. Ahmed, a medical resident here at the hospital. I'd appreciate your guidance regarding a possible drug-drug interaction.
Hi, Dr. Ahmed. I'm Nidhi Patel. I'm the pharmacist in charge. I'm happy to help. Is it regarding a specific patient?
Yes, it's regarding Robert Ruth. He's a 57-year-old male who was admitted for acute coronary syndrome, specifically non-STEMI. I'm planning to prescribe Clopidogrel before his discharge, and I wanted to discuss a potential interaction with his current medication.
All right, sure. Just to update his profile in our pharmacy, I just want to double check his medical information with you. I have Robert Ruth in my system. Date of birth is January 18th, 1968. He doesn't have any known allergy. His medical condition is controlled PUD. He's currently taking Omeprazole, 20 milligrams, one time in the morning. And we don't have a record of over-the-counter medication in our pharmacy. Please confirm all the information are correct.
Yes, Nidhi, that information is correct. Robert Ruth is a 57-year-old male with a history of controlled peptic ulcer disease, and he is currently taking omeprazole 20 milligrams once daily. He has no known drug allergies and no over-the-counter medications have been reported. His kidney and liver functions are also normal.
Okay, very good. And is there anything important about his lifestyle?
The patient's lifestyle factors are not relevant to this particular case. We are focusing on the potential interaction between clopidogrel and omeprazole.
Sure, yeah. There's a true drug-drug interaction between omeprazole and clopidogrel. And actually, it can significantly reduce clopidogrel's blood thinning feature, potentially increasing the risk of heart attacks, stroke, and other cardiovascular complications. Omeprazole can block an important liver enzyme called 2C19 that converts clopidogrel into its active form. Without this conversion, clopidogrel cannot properly prevent blood clots. So yes, there is a true interaction between these two medications, and using them together is not recommended.
Thank you for confirming that, Nidhi. I appreciate you explaining the mechanism of the interaction and the potential consequences. Given this, what would be your recommendation for managing this interaction? I want to ensure Mr. Ruth receives the best possible care.
Yeah, according to our references, we can actually have two different strategies to manage this interaction. So first of all, if patient wants to continue PPI, we can actually switch it to an alternative acid-reducing medication, like alternative PPI, something like rabeprazole or pantoprazole, that they don't have this kind of interaction with clopidogrel, or using any other class of medication to control acid, like H2 receptor antagonist. But another strategy is to actually having a trial of stopping omeprazole for a while, because he's taking omeprazole for a long time and PUD is under controlled. So another strategy is to just having a trial of discontinuation of this medication for a while and to see if patient still needs PPI to control PUD. In that case, so we don't have omeprazole, and so obviously we don't have interaction.
I see. So, if we continue with a proton pump inhibitor, switching to rabeprazole or pantoprazole would be a safer option. Alternatively, we could consider a trial discontinuation of omeprazole since his peptic ulcer disease is controlled. Would you recommend one of these options over the other, or would it depend on the patient's specific circumstances?
Yeah, basically, it depends on the patient's situation. If patient is discharging from the hospital right now, and we don't have enough time to have a trial, or we want to just discharge it safely at the present moment, I would recommend to just simply switch omeprazole to another agent like rabeprazole or pantoprazole and discharge the patient. And when patient is coming back for like reassessment or follow-up in future. So we can have this option to try in future.
That makes sense. Given that Mr. Ruth is being discharged soon, switching his omeprazole to rabeprazole or pantoprazole seems like the most practical approach for now to ensure his safety. We can then reassess the need for a PPI during his follow-up appointment. Thank you for your clear guidance on this, Nidhi. I really appreciate your help.
Oh, my pleasure. Actually, whenever you decide to switch the medication, I can definitely help the patient about patient education or drug information regarding new medication and help them to have a safe switch between omeprazole to another agent.
That's very helpful, Nidhi. I'll be sure to let you know if we proceed with switching the omeprazole. Thank you again for your expertise and support.
Of course, and thank you so much for involving us in patient care. Is there anything else that I can help you with?
No, that was all I needed. Thank you for your assistance, Nidhi. Have a great day.
It's me again. I hope you found the session with our two healthcare professionals helpful. Now, let's take a look at the report on dosette.ca and see how Needy performed in this station. In the meantime, I'd like to invite you to try the same station yourself on dosette.ca and test your knowledge. Later, you can also take a full mock exam there, in an OSCE-like setting, to experience the real exam environment. When you finish a station on dosette.ca, your conversation and performance are analyzed by a pharmacy-trained AI. The system then creates a full report on your competencies, highlighting your strengths and areas for improvement. In this case, the report showed excellent performance across all objectives and competencies. Communication, outcome, and overall performance were all fully solved. There was no misinformation and no risk to the patient. All three competencies, patient care, knowledge and research application, and communication and education, were fully solved as well. The pharmacist demonstrated excellent performance with comprehensive assessment, accurate knowledge, and professional communication. Ready to challenge yourself? Head over to dosette.ca, try this station, and see how you perform. Your personalized AI report will show you exactly where you shine and where you can improve.
dosette.ca, Pharmacy OSCE mock exams, realistic stations and conversation with our pharmacy-trained AI. Improve your score before exam day.